next on Doctor's Diary, Chebet Birir brings you the story of Patrick Kibe at the AIC Kijabe Mission Hospital. Kibe is a true testament of hard work and working your way up the ladder.
On Doctor's Diary, we bring you the story of Patrick Kibe, an ophthalmic surgeon at AIC Kijabe Mission Hospital. Patrick started as a cleaner in the same hospital, and he slowly rose through the ranks to be where he is now. From a cleaner to a storekeeper to a clinical officer and now an ophthalmic surgeon, Patrick has also played a pivotal role in establishing eye and diabetic clinics in the hospital. This is a story of determination, perseverance, and humility.
My name is Patrick Kibe. I am an ophthalmic cataract surgeon working in our department here in Kijabe Hospital. Yes. An ophthalmic cataract surgeon is a clinical officer who have been trained to see patient pertaining eye conditions, so eye patient, make diagnosis, give treatment like eye drops, and also can do some surgeries, and also can give specs where necessary. I come from a family of 10 siblings, and I am the third born. When I was in school, actually I wanted to be a pastor. And so when I finished my Form 4, I got a grade C+. And so I thought that it was a good chance to go to Moffat Bible School to be a pastor. So when I came to Kijabe in 1990 to be a pastor in Moffat Bible School, I sat for an interview, but they could not take me because they wanted to admit students over 20 years and above. And for me, I was less than 20 years. I sat for interview, and they told me that, Patrick, you have qualified. Unfortunately, your age betrays you. So it was quite humiliating for me because that's what I wanted today. I'm telling you for sure, when I was told that I cannot join Moffat Bible School at that time, I shed tears in front of the panel because it's something which was in me. But when I was leaving the room, one of the ladies who was conducting interviews saw how passionate I was, and she followed me. She said, Patrick, I have seen that you want to be really a pastor. But can I tell you something? If you work in a hospital, you can serve and testify and bring many to Christ more than the pastor. I could not understand. Then I said, what do you mean? Then she explained to me, she told me that, and all those patients who are coming to the hospital, the church, they are the one who decide that they are going to the church. But those people who are coming to the hospital, they are forced by circumstance because they are sick. And those people who are going to come to the hospitals, they are Christians, they are Muslims, they are Hinduism, they are atheists, name them. All of them, they'll come to the hospital because they are sick. And so when you are there, being a Christian, by giving them services, they can be able to see a difference in you. And so when you're treating them, even if you're not going to tell them about Christ, they can see your deeds, and some of them, they can see something unique. And that's a time that maybe you can be able to preach to them, and even some of them can get salvation.
Patrick was determined to change lives, so he followed this advice and took the chance he was given. There were separate interviews for nursing that were set to happen on the next day at the nearby Kijabe Hospital. He passed the interview, but as fate would have it, Patrick had to start where he did not expect.
There was no chance for me to join nursing school at that time. But Kijabe Hospital was willing to take me and employ me as a casual laborer. I was employed in a housekeeping department, and my work was only to clean. I was cleaning male ward, known as Wairegi, Salome ward, known as female ward, and also the corridor. I did that work for about 6 months. When I did that work for 6 months, the head of department said that I was doing a good job. And so I was promoted. I was taken to drug stores, whereby I was receiving the drugs and ensuring that the correct drug, everything is recorded correctly. I stayed there for 6 months, and also my work was recommended. So I was moved from the drug stores to Central Supply Department. In Central Supply Department, that's where we used to receive equipment from theater and from the ward that required sterilization. So I was taken to that department, and I worked there for a while.
The little he was tasked with, he did almost to perfection, not knowing that his meticulous way of doing things was a gateway for him to access more opportunities in the same hospital.
During that time, Kijabe used to receive a lot of donations from outside the country. And it happened that a container came from overseas which was full of donated equipment. I was requested to go and sort them out. I sorted them out one by one for about 3 months because I was the only one who was doing that. But the report that I gave after the 3 months to the administration, they compared what actually had been sent from overseas and the report that I had given, and everything corresponded. There was no item which was missing. Little did I know that that was the gateway for me to go to school. After giving that report, the head of department called me, and then he asked me, "Patrick, we really appreciate the good work that you have done. For several years, we have never seen somebody who can give a record which correspond exactly with what was given, which was donated. Some equipment, some things were missing. But your report have really corresponded with what was given. So the question is, Patrick, would you like to go to school?" Remember, I had done in nursing interview, during nursing interview, and I had qualified. I said, yes, I would like to go to school. Unfortunately, I don't have money. The question we are asking you, Patrick, would you like to go to school? I said, yes. I remember it was on a Thursday. They told me, Patrick, pack and go home. You stay home today, Thursday, Friday, Saturday, but on Sunday, report to Kijabe Hospital, School of Nursing, so that to start your training on a Monday. Remember, I had said that I didn't have money, but the hospital paid for me all the dues for my training. That is enrolled nursing. That was in 1993. I trained from 1993 to 1995, and I qualified as an enrolled nurse. Enrolled nurse is a certificate in nursing. I worked in Wairegi. I was deployed in Wairegi ward, that is 1996. Wairegi, again in Sarome. I worked in the maternity.
Patrick was doing so well in his job that he was trusted to develop several clinics and dispensaries from scratch.
That time the hospital was, many of the workers here, they were missionaries. So they requested me if I can go to Kajiado and start a new dispensary. And I agreed. So 1996 mid, I was sent to Kajiado, a place known as Orinio. When you go to Kajiado town, you get in 33 kilometers, a place known as Orinie. Orinie is in Mideast, it's in the bush, but very deep in the bush, and the community there, they are Maasais. So I had to learn the language for a while, and then I started talking to them, and then I introduced them, and I started a new dispensary, which is up to today, it is existing. It is AIC Orinie Dispensary in the Kajiado district. I worked there from 1996 to around 1998, and the dispensary was stable. I had to move again to Kajiado town to start another new dispensary known as AIC Kajiado Child Care Dispensary.
His light was now shining brighter and brighter. Patrick's employer saw it fit to upgrade his skills and abilities so he could now be a leader.
I was among them who was given the first priority to come and do registered nursing. So from 2000 to 2003, I did enroll in registered nursing here in Kijabe, and then I was posted back in Kajiado to be the supervisor of those dispensaries.
It is his experience as a supervisor in Kajiado that gave him the insight to become an ophthalmic surgeon.
There was need for eye issue. There were a lot of eye conditions in Kajiado. So I requested Kijabe whether they can be able to support me to go and do eye issues with the eyes. But it was very difficult. For one to do ophthalmic surgery, one must be trained as a clinical officer. So I had to look for a school so that I can train. But remember, I was a registered nurse. So I had first of all to do clinical medicine, and then after clinical medicine so that I can be able to do what I want to do, that's ophthalmology, ophthalmic cataract surgery. I tried to apply here in Kenya, but it was difficult because it was already they had picked the student. I went to Bare School of Clinical Medicine in Uganda, where I did my clinical medicine. That is from 2004 to 2006. I came back as a clinical officer. I worked in Kijabe. After working in Kijabe for 2 years, then I had to apply for ophthalmic clinical officer in Kenya. But already, they had already picked their students, so I didn't have a chance. I applied in KCMC, Tanzania. That's Kilimanjaro Christian Medical Center. That's where I did my ophthalmic clinical officer and cataract or eye surgery. I did it in 2007, 2008, and came back in 2009. When I came with a qualification of ophthalmic clinical officer and cataract surgery, I started the eye department here in Kijabe.
After he started the eye department, Patrick saw the need to also start a diabetes clinic since he noticed that diabetes and eye problems were related. Since then, Patrick has grown to be an expert in this field.
I started diabetic clinic together with eye clinic in the same room. So from 2010, I have been learning the eye department, whereby we see patients, we make diagnosis, we give them treatment, that's eye drops, we give them maybe surgeries, we do also give them laser treatment, and also we do other form of surgeries because not only cataract surgery that I do.
When Patrick is not doing his eye surgeries, he is a teacher thanks to his zeal and eagerness to pass the baton to his juniors.
When I came back and starting the eye department in Kijabe, I found that there was need because Kijabe is a training institution. I joined Masinde Muliro University in 2015, 2016, 2017, and 2018, and graduated with Bachelor of Science in Medical Education, so that I can be able to teach issues about the eyes, and I can also participate in teaching other candidates in the hospital.
Patrick's career that spans over 25 years has not been as easy. He has encountered numerous challenges that he says have only made him stronger.
After training and coming back, now singling out to ophthalmology or to eye department, there were no equipment. You have finished your training, you have the knowledge, you come to the training, patients are there, but no equipment. That was a big that was a big challenge. But lucky enough to the administration which was there, they assisted me to get some of the equipment. Number two, you have come and the patient have started coming, and you don't have enough personnel. You are the only one, and patients are there, but you are the only one, no personnel. So what do? Training. Looking for other institutions where maybe you can train ophthalmic nursing was a difficult. But I thank God because we have Kikuyu, which trained one of our ophthalmic nurses, and also I sent others to Tenwek Hospital, where 3 more were trained there. So some of the challenges, they are staffing and also equipment, but let alone we have now become stable. But those are the challenges that I was getting during that time.
These challenges have also made him appreciate the wins in his career. Treating patients and changing their lives for the better is what keeps him going.
One thing that makes me happy is when I see a blind patient coming, being supported to come to the eye department, cannot see, and then you see that patient, you take to theater, you operate, and that person is able to say, wow, this is my son, this is my daughter. She can be able to see what is happening. That one gives me a lot of satisfaction, and I feel that I want to continue. Mine is to see whether I feel much encouraged if I see a problem who had issues have come to Kijabe, I have done something, be it little, and then I have changed the life of that patient.
Apart from the satisfaction from seeing people's lives changed, he says that his large and loving family has also kept him ticking.
As I had said, I come from a family of 10 siblings, and they are all there. My parents are alive, although they are aged. My dad is around 8-9 years now, and my mother is now 76. They are aged, they live in Nakuru. And my brothers and sisters, they are there, but different, other doing different things. No, I'm the only one who is in the medical field. I can say that they are proud because when they see me actually doing something that can help people, they feel good. I am married to one wife, and I have 2 daughters. These 2 daughters, one of them is now 21 years. She is doing education, Bachelor of Education in Machakos University. And then my last born is also she's also a girl, and she's in Mount Kenya University doing nursing. She's in her first year. A saying goes, behind a successful man, there is a woman behind that. And I can agree. I got married when I did enroll nursing. So my training as a registered nurse, as a clinical officer, as an ophthalmic cataract surgeon, and also as in university, and also doing fellowship, I have been married. And I can tell you for sure it have not been near my home, because one of the training, like clinical medicine, I did it in Uganda, when my family is in Kajiado. The other training that I did is in Kijabe, when I was doing registered nursing, when my family was still in Kajiado. The other thing is that when I did ophthalmology and cataract surgery, I did it in Tanzania, KCMC. It is outside the country. And when I was there, I also went to India. And my family was still in Kajiado. When I went to Masinde Moriro in Kakamega, my family was still in Kajiado. So I used to leave them a lot. So why? Not because of their support. I could not, or allowing me to go to school, I could not have gone. So my family, especially my wife, have really given me support, allowing me to go to school, leaving the family behind. And I know that even when I'm away, she's there standing with the family, or standing at the gap.
As a father, Patrick's zeal and hunger for education has inspired his daughters to be better than him.
My going to school have also been, actually have been challenging my daughters, and have made them to see, because they have met me going to school, ever since they were born, they met me, after a few months, I'm in school. So even them, they got inspired that they would like also to continue with the studies as their daddy. And when I went to university, they say that, Daddy, we must challenge you. We must go also to university. And so that's the reason why, even up to today, they are telling me that Daddy will challenge you. If you have gone up to degree level, we must go up to master's level. And I tell them, I am already enrolled in master's level. So they are saying, you go to master's level, we go to PhD. So it have been actually encouraging, even to see them, that even them, they are getting challenged because of what I'm doing, and they feel motivated.
You would think that Patrick has reached his end goal, but he still dreams of a better future in his career.
I would like to see Kijabe, eye department, being like other facilities which have eye eye units. An example is Tenwek. Tenwek has a big eye unit, and that's one of it that actually even I keep on coordinating with them, consulting them, and working together. Or Kikuyu. So 5 years down the line, if I see Kijabe at that level, I will feel more satisfied. But still, there is a lot of work to be done. But we can be able to achieve it. If we started from down there and we are here, then we can be able even to go higher.
He believes that he cannot achieve all this without the help of his career mentors.
When I did ophthalmic nursing, and I did registered nursing, and I went to Kikuyu, one man who was very active, known as George Ohito, was a cataract surgeon. And he's the one who told me, hey guy, you can go far. I am a cataract surgeon, and you're an ophthalmic nurse who have done only enrolled nurse. You can go far. And he said that go to school. Don't look at the money, go to school to remain relevant. Dr. George Ohito, who is also the chairman of the OCOA, that's Ophthalmic Clinical Officer and Cataract Surgery Association, he's the one who motivated me. And even today, when I talk to him, he keep on telling me, hey guy, you can go. He's now currently working in CTI. He's the one that I put there, and he's the one that I look upon, and he's a good guy who have made me to be who I am.
His advice to anyone who is starting from scratch?
When I'm here, I like actually motivating people. Even when I see people, somebody who is just doing cleaning, he should not say that I'm just a cleaner. Yes, you're just a cleaner. Do your work diligently, be active, but don't lose your vision. Today you can be cleaning, tomorrow you can be a nurse, the other day you can be a clinical officer, you can be a cataract surgeon, and even you can be an educator, and you can be a mentor, as I have done. So I tell the young one that they should keep on going. On the limit is actually the skies.
Patrick's story is indeed proof that hard work never goes unrewarded. And if you can dream it, then you can achieve it. Chebet Birir for Doctor's Diary, KTN News.